What they've been able to do is begin to study what does the bladder look like when we take an ultrasound probe, just like the ones we use when we look at the baby in a pregnant woman. We're able to take a ultrasound probe just like this, handheld, place this on the abdomen, and actually begin to start looking into the bladder and begin to see the bladder wall, and specifically the Detrusor Wall Thickness, which we're going to talk about right now. Welcome to BPH 360, where bladder health matters. I'm Dr. Wayne Kuang, Cleveland Clinic trained urologist. BPH is not just prostate enlargement. It's about protecting your bladder. Learn to ask better questions, take control. For education only, not medical advice. For your care, consult your doctor. You may know the size of your prostate. You may know your PSA. You may even know your urinary symptom score. But here's a number that almost nobody talks about. How thick is your muscle in your bladder? Because your muscle is not just simply a bag holding urine. Your bladder is a muscular pump. And if that pump has been pushing against resistance for years or decades, that muscle itself may begin to change. And today we're going to talk about another objective bladder health measurement. And that's going to be DWT, your Detrusor Wall Thickness. And as you remember, Detrusor is the name of this red muscle right here. And there is one number I want you to remember, and that is 2 millimeters. Let's start with something simple. The bladder, as you know, has a muscle in it, and that muscle is called the detrusor. When you urinate, that detrusor squeezes, and that's your pump, and it allows you to get your urine out through that prostate that starts off about the size of a golf ball in the shape of a donut, and it has to push that urine through the donut hole. And as we've talked about, as that prostate grows bigger, that donut hole is going to grow tighter. So now that detrusor muscle, the bladder, is having to squeeze harder against resistance from that tight donut hole over years and decades. So what can happen when that muscle repeatedly is having to work so hard? Well, it can change. It can become thicker. And over time, that bladder wall can undergo a lot of complicated remodeling involving muscle and the connective tissue that surrounds it. That's why I don't want you to only think about how big is my prostate. I want you to start also thinking about how hard has my bladder been working over these past years to push urine through my prostate. And that is a bladder first question that we need to answer. So this is the first paper that I'd like to show you out of Europe by Okel et al. In the European Urology Journal from 2007. And let's look at figure 2 in detail. What they've been able to do is begin to study what does the bladder look like when we take an ultrasound probe, just like the ones we use when we look at the baby in a pregnant woman. We're able to take a ultrasound probe just like this, handheld, place this on the abdomen, and actually begin to start looking into the bladder and begin to see the bladder wall, and specifically the Detrusor Wall Thickness, which we're going to talk about right now. These are actual images of the bladder wall taken in patients. And if we look at the arrows in these images, what they're showing is that there's an brighter line on the outside, and that's often like some fat that sits on top of the detrusor muscle, and there is another brighter line on the inside, which is basically this lining that we're seeing inside the bladder, and that's called the urothelium. And the darker layer in between is going to be the detrusor muscle. And that's what we want to measure, the thickness of that muscle. This figure makes it easy for us to begin to interpret the meaning of the Detrusor Wall Thickness. In the bottom left-hand corner, you're going to see the ultrasound of a man without obstruction. And when they measure the thickness of the Detrusor wall, this patch of darkness here in between those two bright lines, they're able to see that it's less than that 2 millimeter number that we want you to remember. In this image, it actually measures 1.7 to 1.8 millimeters, which is less than that 2 millimeter threshold. Then in the remainder of the image, you're going to see in the upper left, progressively men with worsening obstruction as well as progressively increasing thickness to their detrusor wall. So in the upper left, we're seeing now the thickness progress to greater than 2 millimeters. So this measures 2.4 millimeters. Now, as we go to the bottom right, the detrusor wall thickness, that dark patch and band, is now measuring 3.1 millimeters, and then even 6.1 millimeters here in the upper right. Once again, these three parts of this figure were all men who were obstructed. All of them had detrusor wall thicknesses, this black patch or band that is greater than 2 millimeters. Now let's go to table 3, where they summarize the study. They looked at 160 men and used advanced diagnostics to determine who actually had bladder outlet obstruction. The pipe was being blocked off. The men who were not obstructed here on this left side, they had on average a detrusor wall thickness of 1.4 millimeters, and you can see that right here. And for the men who were obstructed, you can see that on average the thickness of their detrusor wall, the DWT, was 2.2 millimeters, and it ranged from 2 up to 2.7 millimeters for the men who were obstructed. That's important because now we can begin to see where this critical number of 2 millimeters comes from. The investigators actually used that cutoff, a detrusor wall thickness of 2 or greater millimeters, for a positive test to help predict who might be at risk for obstruction. So our first lesson is simply 2 millimeters may be an important signal. Remember, it's not a diagnosis, it is only a signal. Now let's see if other researchers were able to find something similar. In this article in 2013, they studied 50 men with urinary symptoms and looked at detrusor wall thickness and compared it against other non-invasive tests. In this group of men, 23 had proven obstruction. Once again, they were going to use that threshold of the detrusor wall thickness being 2 millimeters or more as the threshold for being abnormal. And they were pleased to find that the detrusor wall thickness, DWT, right here, had a 83% sensitivity and a 93% specificity and 91% positive predictive value. Wow, those terms definitely sound complicated. They're not. Let's translate them so you understand the importance of these numbers. The sensitivity of 83%, that's where if we take all the men who really had obstruction, how many were we able to catch using that DWT threshold of 2 millimeters or more? Well, it was about 8 out of 10. That's pretty good. More precisely, for this study, it was 19 of the 23 obstructed men who had a positive test with that detrusor wall thickness being 2 millimeters or more. Then the specificity, 93%. Now, if we take all of the men who did not have obstruction, how many did the test correctly identify as being negative, as not being obstructed? 9 out of 10. Nice. Then the positive predictive value, 91% right here. That's where if the DWT was 2 millimeters or more on the ultrasound study, how often did that man actually turn out to be obstructed? And again, about 9 out of 10. Specifically, 19 of the 21 men with a positive DWT test were obstructed. While those numbers are impressive, they are not 100%. And that's why I do not want you walking away saying, hey, my DWT is 2.1, therefore I have prostate obstruction. The correct conclusion is that's another objective finding, an objective signal that I should understand a little bit better. Let's pause. Man vs. Prostate has partnered with ProudP, a smartphone-based app that helps you measure your maximum flow rate of urine from the comfort of your home. To support the campaign, enter the referral code MVPWK. On the home page, you'll see that hamburger menu sign. And if you click there, go to Profile, and then enter in the referral code MVPWK. If you've been living with urinary symptoms, Proud P is one tool that may help you change the conversation that you're having with your doctor, because now you're coming in empowered with data. Note, if you access Proud P through Man vs. Prostate, there may be a partnership benefit to this campaign. Our message remains the same. Use data to make better bladder health decisions. Proud P is available in North America. The mission is to help you get your data earlier before it is too late. Now we need to look at the opposite question. If 2 millimeters or more is concerning, what does a healthy bladder muscle actually look like? Okol and colleagues also studied healthy adult volunteers in this study, 55 healthy adults ages 15 to 40, and they discovered that the amount of urine in the bladder matters when you measure the DWT. During the first approximately 250 milliliters of bladder filling, the detrusor wall gets thinner as the bladder stretches. So on this bottom horizontal x-axis of this graph, you'll see it goes from 0 to 900 milliliters. That's the amount of volume in the bladder at the time of the ultrasound. And we can see that here's the number 0, and here's that number of 250 that we're talking about. And as that bladder's being filled up to about 250 milliliters, we can see on the y-axis, this vertical line here, that's the detrusor wall thickness. It starts off thicker, and then as that bladder fills up to about 250 milliliters, it's actually thinning out. And then beyond 250 milliliters, as we move out to the right, it remains stable. And that makes sense. If we take a look at this balloon, it's actually a condom for the prostate ultrasound probe that we'll use, but it will be suffice. You can see right here, it's relatively thick. You can't really see through it very well. But as we begin to allow it to fill up, like if it was a bladder, the bladder wall begins to thin out, and we can now really start to see it thin, as well as my finger clearly through that. So returning to this graph, that first part of this graph makes sense, right? As we see this bladder fill up to about 250 cc's or milliliters, that wall thickness of the bladder is beginning to thin out. What's really neat about the bladder, it's just an amazing organ. I mean, that's why it's not routinely transplantable. It has so many features that make it so special. At above 250 milliliters, the thickness of the bladder remains stable. And as you can see on this graph, if we take this and move it across to the x-axis, we see that for this man, thickness here was 1.4 millimeters. And in this group of 25 men, the average thickness for their detrusor wall thickness when the bladder was filled at or above 250 milliliters, their DWT was 1.2 to 1.6 millimeters. But there is an important qualification. These were all younger, healthy men, so please don't turn 1.4 millimeters into some universal normal value for every 70-year-old man who's having issues with urinary symptoms. What this study really gives us are two lessons. One is that healthy bladder muscle thickness can substantially be below 2 millimeters. And secondly, we all need to pay attention to how full the bladder is when we take those measurements. Fast forward to 2019, Suavely and colleagues published a review of newer diagnostic tools being investigated for male urinary symptoms. DWT, detrusor wall thickness, was one of them. They looked at a previous systematic review containing 8 different studies that looked at DWT. Different investigators had used thresholds ranging from 2 millimeters to 6 millimeters. But here's what caught all of our eyes is when we look at detrusor wall thickness and we look at all of these different groups from around the world who looked at DWT, 5 out of these 8 used the threshold of 2 millimeters, and their group analysis reported approximately 83% sensitivity and 93% specificity. And that is, how well did that test correctly find all of the men who were truly obstructed, as well as how well did the test correctly show those men who were not obstructed to be not obstructed. And it was pretty good. 8 out of 10 for the former and 9 out of 10 for the latter. And now we're seeing that this is not just from a single isolated study, but now we're seeing a pattern begin to emerge as we're seeing similar findings from various groups when they look at that threshold of 2 millimeters or more. So now I want to take you to another study from the African continent, from the country of Nigeria. They evaluated 110 men with clinical BPH using ultrasound to look at things like DWT, Detrusor Wall Thickness. Their average prostate volume was large, about 94 milliliters, and their average DWT was 5.9 millimeters. They found a statistically significant positive relationship between the size of the prostate and the DWT, Detrusor Wall Thickness. And I want to make an important distinction. This is not the same type of study we saw previously where they were looking at the diagnostic accuracy of DWT, because in this study they did not use advanced therapeutics and diagnostics in every single man to prove who was and who was not obstructed. What their study was able to show is that thickened Detrusor walls, DWT, was extremely common in this population of men with urinary symptoms with clinical BPH. Only 10% had Detrusor wall thickness, DWT, in this range marked 0 to 2. Impressively, see how some of these men had DWTs as thick as 15 to 17 millimeters. The bulk actually had thicknesses between 3 and 8 millimeters, far greater than that threshold of 2 millimeters that we've been talking about. The bigger reason that I want to share this paper with you is that ultrasound technology is widely available throughout the world in both lower and higher income healthcare systems. And the authors specifically point out that DWT can be obtained from the surface of your abdomen, from your belly. We can use ultrasound just like we look at a fetus in a pregnant woman. We can do the same thing to actually look at the bladder, and specifically at the Detrusor wall thickness. And these authors point out that it is a relatively cost-effective technology, and that matters. It matters because if we are serious about preserving bladder health globally, our tools cannot be dependent on expensive or highly invasive technologies. Sometimes there may already be valuable information just sitting right there available to most countries throughout the world on an ultrasound machine. We just have to choose to look for that piece of data. Now let's finish the evidence story with our largest study. Kuang et al. In 2022 did a meta-analysis, and that's a fancy way of trying to look at all the existing data from all of the studies to make some impactful conclusions that we all can learn from and apply to our healthcare systems. Here they looked at the diagnostic value of non-invasive methods for diagnosing obstruction in men with symptoms. Instead of asking, what happens in a small group of men, 50 men, 100 men, they reviewed 51 studies involving 7,897 patients. They compared multiple non-invasive approaches to detecting whether or not there was obstruction in these men. And when they looked at all of the DWT studies using our familiar 2 millimeters or more threshold, this is what they found. We can see here down below these fancy graphs, that here the top line is the DWT. They found that at that threshold, The sensitivity was 79% and the specificity was 89%. Let's translate that one last time. With that 2 millimeter threshold, DWT identified roughly 8 out of the 10 men who actually had obstruction and correctly identified roughly 9 out of 10 men who did not. That is enough performance to make DWT interesting. It is not enough performance to make DWT the entire diagnosis. And that distinction is critical. It is one more measurement that we need to factor in. It is one more signal that we add to the equation as we look at the IBPSS 8 and above alone or in conjunction with other signals like the Qmax, PVR, and the DWT. This is the most important part of today's episode. I do not want you walking away believing that you need 4 abnormal tests before you're allowed to worry about your bladder. You don't. Let's start at the beginning. An IBPSS of 8 and above alone means your urinary symptoms are already in the moderate to severe range, and that alone is enough reason to ask, what about my bladder? You do not need to wait for another abnormality to start that conversation. But now suppose you start layering on these different signals, more information. Your Qmax is less than 15. That's another signal. Your PVR is now over 100 milliliters. That's the amount of urine left behind after you have thought that you have emptied your bladder. That's another signal. And now an appropriately performed ultrasound adds one more signal, and that's the DWT, the Detrusor Wall Thickness, using a threshold of 2 millimeters. Think of all of these pieces of data as clues. One clue points toward possible bladder trouble is enough to get your attention. 2 clues is telling you, hey, it needs more attention. And now 3 or 4 clues is lowering the threshold even further. We're taking your evaluation to the next level. And that's what the triangle of triage is designed to do. It is not pass 3 tests and now you have obstruction. It is, when should you and your physician stop treating this as simply a symptom problem and start asking more questions, have more dialogue about your bladder? And in the man versus prostate pathway, these findings can help trigger a discussion about establishing what we see here in the upper right corner, which is a bladder health baseline, starting with a minimum of a camera called a cystoscopy, being one of those tools, diagnostic tools, that we will need to discuss further at future episodes. One thing I want you to remember. If you remember nothing else from this episode, remember this. 2 millimeters is not a diagnosis. It's a clue. Your symptoms are a clue. Your flow is a clue. Your residual urine, that PVR, is a clue. And now your bladder wall, your Detrusor Wall Thickness, the DWP, is yet another clue. And the more that those clues begin telling the same story, the harder it is to justify ignoring your bladder. So the next time somebody talks to you about BPH and tells you, how big your prostate is, ask one more question. What does my bladder look like? If your IBPSS is 8 or higher, you already have a reason to start a conversation. And if your Qmax, PVR, or DWT, Detrusor Wall Thickness, are also abnormal, you have even more reason to understand what is happening. And in the next part of this diagnostic journey, we're going to keep moving deeper into that triangle of triage and eventually into cystoscopy, that camera, where we can actually take a look inside the bladder and the prostatic urethra. Because yes, your prostate matters, but the organ that we are ultimately trying to save and preserve is your bladder. Remember to ask, #what about my bladder? Thanks for watching. If bladder health matters to you, watch more. Follow BPH 360 to stay ahead of your symptoms. Listen on Spotify and Apple Podcasts.